A very good afternoon to everyone. I'm Dr. Roza Olyai, obstetrician and gynecologist from Gwalior. And today I'm going to talk to you about a very important topic which is very common, infertility. Infertility means when a couple is married for about a year period and they're trying to conceive, trying to get a child, but they're not able to conceive, to get pregnant. So there are certain causes which are related to this. And most often the couples, they don't know what to do. And the society, of course, is all the time, pressure of the family, the in-laws, friends, that you're married for 1 year, 2 years, you haven't yet, been able to conceive. So what are the reasons? What are the factors and what we can do to, help the couple to conceive? So first of all, let us know that how long can a couple wait? We can, after you're married, it takes about 6 months to 1 year after your marriage when you want to get, pregnant. So that means if a year is passed and you're not able to conceive, you need to visit a doctor. There are many factors which are related both to the female as well as the male. So if we say it's 35% on the female and 35% equally on the male, and if both of them have got issues, nearly 20% of the population have got both the factors, the male as well as the female. There are 30% of the reasons, the causes that it's unknown, So there are medications, there are very good investigations that one can, approach and find out the reason. There are certain factors which are common to both. So I say that obesity. Nowadays, the rate of, obesity is on the increase with the kind of lifestyle that we have. So you need to help yourself with the BMI to decrease your BMI. So obesity is one factor. Other factors are, if we talk about the female, it's the hormonal issues. The hormones which are secreted in the brain, comes and has its effect on the ovaries, which are by the side of the uterus. So if there is an imbalance on this could lead to infertility. So beside hormones, we have sometimes issues related to the female organ, that's a uterus. So in the uterus itself, there could be some infection. It could be also related to kind of fibroids, tumors, abnormalities of the uterus. There could be, issues that the uterus is not well formed. So that also could be one reason. Other factors could also be related to smoking, alcohol intake, drugs, medications, sometimes radiations, if you've taken some kind of treatment which will affect the ovaries, and the ovaries, will not have enough egg to produce. Age could be one factor. So if you're above 30 years, you need to be a little careful and get pregnant soon, and you need to visit your doctor, not to delay it, because we have a hormone called AMH, which if it decreases, that talks about the strength of the ovaries, the amount of egg that you have, the reserve of your egg. So these are the investigations that one could do with blood tests. We also have x-rays, like we have the hysterosalpingographies, because there are sometimes factors related to the tubes. We may have the tubes being blocked. So you need to also know about the status of the tubes. So if they are blocked, where there are, procedures like laparoscopy that we could do to recanalize or open the tubes. However, overall, if you see that, the chances of you getting pregnant in any ways, whether you are doing it with medications, proper timely intercourse, when the ovulation takes place. Usually if you have a proper cycle, it's mid-cycle that you ovulate. So you need to know the time that you're ovulating, that you could have the sexual contact during those very periods. So you need to visit your doctor, you need to be, aware of the situation. Most often couples don't know that when is their ovulation, how one gets pregnant. So timely sexual contact would be very important. Also, we have, medications, hormones, which could be given if there's an imbalance. So things are there, and sometimes even, the problem is with the male factor. The sperm count is very low. So we have the intrauterine insemination, which is called IUI. That also can be tried when the semen is taken, washed, and inserted inside the vagina. So further on, if with this it fails, we try for 3-4 cycles. If it fails, then we escalate it and go to the next step, which is an IVF, in vitro fertilization, which is very simple. It's a procedure of taking the egg from the ovaries and the semen. They wash it in a petri dish, insert it inside the uterus. So all these take a little time, but you need to have patience, you need to have hope, you need to be positive, because anyway you can conceive. Now we have so many medications, so many guidelines which have come, and many techniques are there that will help you. So don't lose hope, be happy, be confident for the future, and visit a proper doctor and get the proper counseling done. All the very best to you all.